Hello, my name is Jackie Ding, and I'm currently doing my PhD full time at CP Achieve and Monash University. I'm fairly early on into my PhD, and I've just completed my 6 months review last week. The working title of my PhD thesis is Exploring Young Adulthood Experiences and Perceptions of Participation for Those with Cerebral Palsy. There's currently relatively little research that has been done in the Australian context to really understand the perceptions, experiences, and also needs of individuals with cerebral palsy as they transition into adulthood. So my PhD project will really focus on involving a mixed methods approach to look at what factors may impact the transition to adulthood and beyond for adolescents and young adults with cerebral palsy, and hopefully just development of and trial of educational lifestyle modules to optimize agency and also support that important milestone. In addition to my PhD, I also work at the Murdoch Children's Research Institute within the Centre of Community Child Health as a project officer for 2 days, which is a really great way to kind of break things up a little bit and do my PhD and then focus on my other role for the other 2 days, which has been wonderful. So each day is different. And I think that's probably one of the great things I love about doing a PhD. There are no 2 days that are the same. It really just depends on which stage I'm at with my PhD as well and what my tasks are. So in the first few months of my PhD, I spent time familiarizing myself with the research project, reading lots and lots of background research papers and working together with my supervisors to really define and map out the scope of my PhD. And during this time as well, I also started writing out a research protocol, prepared and submitted an ethics application as well. And then while I was waiting for my ethics, I was piloting my interview questions with 3 independent co-researchers, all of whom have lived experience of CP. And this process has really helped build my interview skills, which will come in handy as I begin to conduct interviews later down the track. One surprisingly great thing that no one really told me about before I started my PhD was how flexible my days can be, particularly now with everyone working from home. I'm someone who's really, I would say, very self-motivated. So I quite like the flexibility and I'm able to kind of keep myself accountable with to-do lists and setting tasks and deadlines for myself, even though there might not be particularly deadlines. And I guess now that I've got my ethics approval for my qualitative study, I'd imagine I'll be spending the bulk of my time interviewing participants, transcribing interviews, and starting to analyze those findings. I love that I get to work on my own research project, especially on a topic that I find really exciting. I've always been interested in the disability sector and I've always knew that I wanted to help people. So having the chance to be involved in a research project or a research topic that directly works with young people with disability and knowing that the work that I'll be doing will make a positive influence in young people with cerebral palsy's lives, I guess that in itself is just so rewarding. Not to mention, this is also, I guess, a fantastic opportunity for personal growth. Just doing a PhD in itself, you're developing that resilience. You have to think critically through problems that you might face and also just practicing discipline as well. So I'm very much looking forward to further developing those skills throughout my PhD journey. Most challenging part, I guess I would say having a flexible workday could be, I guess, a double-edged sword. As with flexibility, it also means it can be quite tricky sometimes to stay motivated. Some days I set myself quite an ambitious list of things to do. And then at the end of the day, I only tick up a couple of those things. So I can be quite hard on myself in that sense because some things do take a little bit longer than expected or other things might come up that need to take priority. So I'm really just to learn to remind myself that it's important to take the small wins and focus on each day as it comes. I think another challenging aspect of my PhD and possibly in PhDs in general is that the project at any point can change direction and you've got to have to be really ready to move along with it and also pivot. Sometimes it can be quite a tough mental game when you know that there's that uncertainty of what's to come. But as a wise person once told me, you just need to trust in the process and all shall work itself out. I think even just looking at that when I first saw the recruitment for the PhD position, it was just mainly about looking at the transition into adulthood for young adolescents with cerebral palsy. But I think my supervisors had an idea of what the project was going to be about. But then there was a lot of flexibility in terms of where I wanted the direction to go. And I think now that I've started to do recruitment and once I start to interview people, I think it will really hone in on what are the gaps and what needs to be addressed. So I think in that sense, at this point in time, we all have an idea of where it would go. But once we actually get the data, it might change completely. This question always stumps me, and I'd be lying if I told you that I never lost sleep about this. If someone told me back, I guess, 5 years ago that I'll be doing a PhD, I would probably brush it off and thought, as I thought I'd just never pursue a career in research. But so much has changed. And I think the final decision to even start a PhD came from various different sources. So my interests and also the people that I was exposed to at my other role as a project officer, and also just chatting to my colleagues and hearing about their experiences, as well as just realizing that research is one of the, I guess, the most powerful ways to help people, not just individually, but on a broader level. I would be open in 5 years' time to potentially think about doing a postdoc, go down the path of academia, or even perhaps just moving overseas if the opportunity presented itself. I think I'm going to be just quite open-minded and not to put all my eggs in one basket. And I just do hope that whatever I do pursue in 5 years' time, it's something that I'm passionate about, gets me out of bed in the morning, and that I'm working on something that is going to be really impactful, making a difference in people's lives. I think it's a sense of community and being part of something bigger than just your PhD project. At CP Achieve, we have monthly catch-ups with other CP Achieve PhD candidates as well as postdocs. And it's just been really great to be able to have that platform to knowledge share and also to update each other on our progresses. So it feels like we're not actually alone in just doing our own research. And I guess also just working alongside industry professionals who have just so much knowledge and expertise and are just always willing to be able to take time out of their days to help. Yeah, I'm just very proud and grateful to be a part of CP Achieve and to be able to work alongside such inspiring and passionate individuals that I can call my colleagues. And there's also this common misconception that doing a PhD can be quite lonely, but it doesn't have to be if you have the right support around you. So I recently received ethics approval for the first study of my PhD, which is a qualitative study. And I hope to recruit young people aged between 16 and 30 years old with lived experience of cerebral palsy across a wide range of physical, communicative, and cognitive functions, and just really want to capture their experiences through a Zoom or an email written interview. I can leave my contact details below, as well as some further information about my research project and how to get in touch. So for anyone who may be interested in participating in my study, please feel free to reach out.